Hi everybody, Jared O'D here at Dynamis. I want to talk to you about a court case where a 75-year-old man with dementia living in a care home had committed some 13 different assaults in a short period of time. 5 of them were serious physical assaults, including one where he'd actually attempted to strangle another resident who was in the care home. Now, one of these incidents involved a physical injury to one of the staff, and that resulted in a court case, which I want to talk to you about today. Some interesting points in it. First of all, I should tell you, the care home defended itself in the case by saying that, look, this is a 75-year-old man who was fairly weak and fragile. Nobody had suffered any significant injuries up to that point, and how were they supposed to know? So something we could see, quite a normal response, if you like, that most people would have when looking at an incident of violence and aggression with somebody with dementia. However, the witnesses in the case did say that this was quite a fit, strong, and capable person who at times had been found trying to climb over the fences at the back of the property in the care home. So they established that he was very capable physically. The care home responded by saying they have an onus to look after vulnerable people like this man. They had increased his meds. He was in condition amber just before the time that he made this physical assault, and that there are huge difficulties in moving these people on, so how could they be liable when they're just trying to do their best in difficult circumstances? Interestingly, in this case, the judge conceded some of those points. He said, look, it wouldn't be reasonable to lock this man in his room all day and isolate him from other people to stop the assaults happening, nor would it be reasonable to expect the care home to employ many more staff to keep him constantly monitored all day long. However, he did then make some clear judgments about how these things should be managed. And he said, once it had been established that the level of risk to staff was higher than was properly acceptable, bearing in mind the employer's responsibilities under health and safety law, then the defendant should have ensured that the person was moved on into a more safe and secure environment for them. And we can see in the legislation and in the case law, of which there's some examples here, that it's well established that an organization cannot just keep executing a work task and asking its staff to continue in dangerous circumstances that are left uncontrolled. And the case law example there, in fact, is of the ambulance service. Even when it's a public service, there are still, where there are risks, they must be controlled, and there are obligations on the employer there. The judge noted in this case, for example, that there was no evidence of training for the staff in methods of self-protection, even though they'd been exposed in 4 or 5 recent cases to physical assault, 2 attempts to strangle patients, and the elderly man in question had actually struck somebody over the head with an implement. So however praiseworthy it was that the staff were persevering, the judge said that they had been exposed to an unreasonable risk of sudden physical attack. He mentioned that they had an obvious reluctance to engage in physical self-protection, because if they did so vigorously, then they'd be in fear of injuring this elderly patient. He determined in the end that it couldn't be right for an employer to continue seeing minor injuries happening near misses and not be addressing them because there was nothing serious or that nothing significant had happened up to that point. He didn't see that this was correct. And he also said that although running care homes is a desirable activity, it shouldn't be done in such a way that poses risk to the staff who are carrying out the tasks within it. So this case highlights some really key points for us. I hope that this brief presentation about those things has been helpful to you. And if you wish to learn a little bit more about what we do, or we can help with an issue of workplace violence that you have at the moment, please get in touch and we'll do our very best to help you.